Cardia cancer accounts for approximately 15% of digestive cancers, and its frequency is increased by the presence of an Brachy-esophagus, a condition in which the esophagus undergoes cellular changes that can precede cancer. The most common type of cardiac cancer is adenocarcinoma, which constitutes a large majority of cases of this disease. This type of cancer generally occurs between 55 and 65 years of age, with a predominance in men, although cases can occur earlier in life, particularly in individuals with a history of conditions like an untreated gastroesophageal reflux. The main symptom associated with cardiac cancer is lower dysphagia, that is, difficulty swallowing, particularly solid foods. The diagnosis of this cancer is based on an esogastric fibroscopy, which allows direct observation of the lesion, as well as on biopsies to confirm the cancerous nature of the tumor through histopathological examination. The treatment of cardiac cancer is mainly surgical, with removal of the tumor for curative purposes. Sometimes radiochemotherapy may be added, particularly in more advanced cases or when surgery alone does not seem sufficient. The prognosis of cardiac cancer is strongly linked to the early detection of the disease, as early detection allows for curative resection. If the cancer is detected at an advanced stage, the prognosis becomes less favorable, highlighting the importance of monitoring and screening in at-risk patients. Follow-up after treatment is lifelong, with rigorous monitoring to detect any recurrence or surgery-related complications. Several risk factors are associated with the development of cardiac cancer. Precancerous lesions can progress to cancer if not properly managed. Chronic gastroesophageal reflux, when untreated, can lead to peptic esophagitis, an inflammation of the esophagus which can in turn develop into an Brachy-esophagus. Alcohol and tobacco are two of the main environmental factors associated with an increased risk of cardiac cancer. Caustic esophagitis, caused by irritating chemicals or radiosensitizing treatments such as radiotherapy, can also promote the development of cardiac cancer. An important point to note is that infection with Helicobacter pylori, although a risk factor for many types of gastric cancers, is not considered a risk factor